Namaste. After a gap, we are again restarting these videos on various psychological problems. So today I thought I'll speak on alcohol de-addiction because this is a public health problem, and this is a video sponsored by One Good Step and A.V. Badiga Memorial Hospital. One Good Step is a NGO which works in the field of health and education. A.V. Badiga Hospital is a hospital which caters to middle class and lower middle class and the poor, providing affordable medical health. And in fact, area of interest of Dr. A.V. Badiga Hospital is psychiatry. So basically whatever I am going to talk, it is not a substitute for psychiatry consultation. Please understand this. I am just going to give you outline about this alcohol de-addiction. So who are the patients who are admitted for alcohol de-addiction? It's not that everybody who uses alcohol is brought to the de-addiction center. A patient who develops social occupational dysfunction, a patient who is unable to control once he starts drinking, a person who has problems in his health, say liver disease, or he develops untreatable, incurable diabetes because of his excessive drinking, or if he develops confusional state called as delirium. These are the patients who are brought for alcohol de-addiction. Of course, there is a set of patients who go into what is called as binge drinking. They drink almost over 5 hours, they drink more than 5 pegs, and they land up with some medical problems. And these are the people who are referred either by a physician or they themselves are motivated to stop alcohol. Any patient who is brought to the de-addiction center, the most important thing is motivation. So basically, what is the process? In alcohol de-addiction, first thing we do is what is called as detoxification. When the patient stops alcohol, he develops what is called as withdrawal symptoms. He may develop what is called as simple withdrawal. He may have sleeplessness, vomiting sensation. He may feel jittery. He may come to know his heartbeat. He may feel tense. He may feel worried. He will have totally lack of sleep. So these are the simple withdrawal symptoms, but there are what is called as complicated withdrawal symptoms. One of the important thing is what is called as delirium, where a patient starts hearing somebody speaking to him. He sees in front of him snakes or small animals like insects, cockroaches, rats. They are not there, but he sees them. This is what is called as visual hallucination, and he becomes very afraid. He becomes tremulous. That is why this particular entity is called as delirium tremens. And remember, almost 1% of these delirium tremens, if not treated properly, can die. So this is a very important medical emergency. Then of course there is what is called as seizures, epilepsy. If a patient doesn't drink or he reduces the quantity of alcohol, he can suddenly develop fits. These are called as REM fits. So these delirium and REM fits are called as complicated withdrawal. So these patients, usually we admit them. Many of these patients with simple withdrawal state can be treated on outpatient basis. But if they develop complicated withdrawal state, that is delirium or fits, they should be admitted. So this is, once they are admitted, we put them on medicines which act just like alcohol in their body, but do not have all the ill effects of alcohol. They are not bad to the liver, but they may have some of the qualities of alcohol. That's why we make it a point to reduce and stop it. So these drugs are called as benzodiazepines. Initially we start them on this. This is the process. This is the process of detoxification. It takes around 1 week, and in the hospital stay, we identify what are the factors for which a person drinks. A person may drink because of some psychological problems. This is what is called as self-medication hypothesis. A patient has depression. To forget depression, he drinks. A patient cannot face people. He feels afraid to face people. He has social anxiety. So to face people, he drinks. So these are the psychological factors. Then there are family factors. Sometimes patients have some family issues, interpersonal problems with their parents or with their spouses, or their siblings. So because of which they are stressed and they drink. And then there are social factors, friends forcing them to take alcohol. They are living in a community where most of the people are drinking. So these are the situations where people drink. So we identify what are the psychological, social and family factors. And treatment involves, the first thing is counseling. Counseling the patient about the ill effects, looking at his motivation. See, it's not that one type of treatment treats everybody. It is tailor-made. Just like when you go to a tailor, he chooses the dress for you based on the measurements. Similarly, we take measurement of how much he is drinking, what is the effect on his liver, what is the effect on his brain. We ask so many questions, and all this starts in the process of counseling. Then we also identify what are the reasons why a person drinks, the cognitions, the thinking. Many times they have the feeling that they are inferior to others. Many times they have some suspicion on others that they are talking about them. They want to retort back to them, so that they drink. So basically we try to find out what are the reasons why they drink. So these counseling and identifying the cognitions, this is the first part. Then of course we try group therapy. We in our specialized centers, basically a group of patients having similar problem, they are given some classes, group therapy on different topics like ill effects of alcohol, how to control craving, how to prevent relapse, and they are sent to what is called as Alcoholic Anonymous meeting. Alcoholic Anonymous is a self-help group. This basically is a sort of group where people who want to leave alcohol, they join together. These meetings take place outside without any professional help. They take place outside the de-addiction center, and basically the professional has no role in it. It is only a group of people who have themselves stopped alcohol using this self-help concept. So these are the non-medical things that go on in the de-addiction center. I can't say non-medical, I would say non-pharmacological things. Then comes what is called as pharmacological remedies. See, basically as psychiatrists, we are the persons who are responsible for treating patients with alcohol problem. So basically we use some drugs which reduce the craving. There are drugs like baclofen, topiramate, acamprosate, naltrexone. These are drugs which reduce the craving for alcohol. Then there are drugs which cause aversion. If a person is taking alcohol and he drinks, then he develops a reaction. This particular drug is called as antabuse or antidic. So the person starts vomiting, person's BP comes down, person falls suddenly because the BP comes down, he has severe sweating, he has tremors, he has problems when he is taking alcohol along with the medications. So this particular thing is called as an aversive treatment. Then of course we treat with psychiatric drugs. Sometimes we, as I told you, for detox we use benzodiazepines, and if the patient is having decreased sleep or if he is having depression, we may use some antidepressants, we may use some anti-anxiety drugs if he has anxiety. Sometimes patients drink because of certain diseases like bipolar disorder, psychosis, schizophrenia. So we give them medications to treat these diseases. So one thing is, you should be very careful. Don't continue any medication which has been started once by a doctor. Don't continue without prescriptions. Don't continue medicines without consulting a doctor. Please understand that many times, many of these medications prescribed by the doctors, they themselves have addictive potential, especially those medicines which we use for detoxification. Please be careful about it. So I think I'll stop at this, because our aim is to see that the videos are short and interesting. So maybe if you have any questions, I will be very glad to answer. So basically, please understand that this is not a substitute for psychiatric consultation. Our aim from One Good Step and A.V. Badiga Memorial Hospital, in these programs, the Mind Your Mind, this is the name of this channel, is to create awareness about mental health, so that many of these people can accept the problems they have, they can analyze why they are having this problem and take action. That is the main spirit behind this video. Please press the bell button, please subscribe these videos, Please encourage us and please be participative. We expect that you comment and also tell us, ask us questions and tell us any new things you want. Thanks for a patient listening. Jai Hind.